The U.S. Supreme Court has ruled to allow Tennessee to keep its ban on gender-affirming care for transgender minors. While another 26 states have laws like that, here in Colorado, care for transgender youth is protected by law.
Well, that ban affects gender transition surgery, puberty blockers, and hormone therapy, for those under 18. We wanted to further the discussion and bring in Dr. Pyle Coley to discuss gender dysphoria first. Let's start there. I think that's a good place because, I mean, is that a diagnosis? Like, from the medical perspective, right, where do you stand?
There's a lot of confusion about these terms, so I'm glad we're talking about them. So gender identity is which gender do you identify with? Is it male, is it female, or is it neither? It could be a sort of a spectrum or a blend of the two. Gender dysphoria is when your gender identity does not line up with the sex that you were assigned at birth. So there's a discordance. So gender dysphoria by definition means that you have distress as a result, because your gender identity itself doesn't cause distress, but the discordance between who you are and what you want to be is what causes distress. It's a psychiatric diagnosis. In fact, they put it into the psychiatric literature as a way to allow people to access care to help sort of ease the consequences of gender dysphoria.
And it's the consequences that I think most parents are or should be concerned about. So what are the arguments for and against when it comes to minors transitioning?
Yeah, this is really tricky. So the medical community is kind of divided on this, really, because there's no, correct answer here. It's all gray. And so the arguments for it are that if you have gender dysphoria, it helps to relieve it, even as an adolescent, if you have access to care. Certainly, you feel you have more informed consent as an adolescent yourself. If you can make decisions, you have choice, freedom of choice for your body. And mental health stigma is actually lower. So adolescents who are allowed to transition have fewer mental health problems. But the flip side of the coin is you're just an adolescent. You haven't even completed puberty yet. You haven't even sort of defined your sexuality or gender identity yet. There's still a lot of plasticity in the brain that makes your decision-making more immature. So you don't have great impulse control as an adolescent. That really develops more in our 20s. And there's the idea of parental consent and the idea of regret. When you get in your 20s, you can't really undo this once you've done it. So that's kind of the two sides of the coin. And it's interesting, but a lot of medical community providers are divided down the middle. The guidelines do have some recommendations, though.
Well, I'm curious, it's a decision by the highest court that we know it's going to reverberate throughout the community and what a lot of folks are thinking. What implications does this have?
Oh, this has tremendous implications. Of course, on clinical care, like how we treat the kids that are already transitioning, the ones that may have wanted to transition, but also on research. And this is an area where we don't know much. We don't have a great body of literature to guide us. For example, me as a cardiologist, if I see somebody who's transitioned, do I treat their risk factors as male risk factors or female? Does it matter when they transition? Does it matter which hormone they're exposed to now? Same for cancer risk. How do you think about their cancer risk when they're getting hormone therapy? So I feel like we need a lot of research here. And this is going to sort of close the door, at least on adolescents and that body of research. Currently, the guidelines, the American Academy of Pediatrics guidelines, allow transitioning and recommend it if it's indicated for adolescents. So they're saying you don't have to wait till you're an adult. And same for the Endocrine Society. But the Endocrine Society has age-specific cutoffs, meaning you can't start to give hormone therapy and such until they're 16. You have to have a certain amount of sexual development before you start doing the transitions.
And I think just with all the nuance here, I'm concerned and I know a lot of people are, I'm echoing a lot of people's sentiments of the care and the consequences and the variables that will come following when it comes to LGBTQ plus youth. For instance, the Trump administration, they want to cut funding for specialized services for LGBTQ plus youth on the 988 suicide hotline is one of them, the crisis hotline. So as a physician, how do you feel about, there's so many layers to this.
I'm really concerned that this has set a precedent, a legal precedent for now the medical community to sort of follow, where we do feel like not just the physical services, but the mental health services, the research services available to this body of literature is going to start to disappear. And the crisis hotline worries me because now you've sort of done two things simultaneously. Hopefully that won't come through, but if it does, you've taken away the ability to transition, and then you've taken away the resources that help people cope with gender dysphoria who can't transition anymore. And now you're really sort of amplifying the effects of what you're doing. So I think we have to be really careful here. We're making decisions that are going to change people's lives, change change their identity, change everything about who they are. So we have to be extremely careful that we're doing it with the right body of evidence and scientific literature.
Important perspective as always, Dr. Coley. Thank you.